Should the government force us to wear masks when we walk outside? And on the other side, should you just decide to wear a mask if you want to protect yourself? Hey everyone, I'm Chad Hasty, host of the Chad Hasty Show, weekday mornings 8:30 to 11 a.m. Central Time on News Talk 95.1 FM and 790 AM KFYO. One Texas city is forcing all their citizens, whenever they go out to a grocery store or go out to any other business that may or may not be open these days, to wear masks when they go out in public. Now, when you go for a walk outside, you don't have to wear a mask. If you're just exercising, you don't have to wear a mask. But if you're going into other public buildings, they want you to wear a mask. The city of Laredo wants their citizens to do this, and if they don't comply, they could be fined or even hauled off to jail, though that's most likely not going to happen. Police have just been politely reminding people, hey, cover up when you go into the grocery store. So should people wear masks when they go to the grocery store, when they go out to one of the big box retailers that are still open in Lubbock, or anywhere else they go? It's kind of a mixed bag. The CDC now recommends that you have some type of face covering if you go out to, let's say, a grocery store or a crowded space in areas that have a high transmission rate of COVID-19. What is high transmission rate? They don't really define that. But when you think of it, I think of Dallas. I think of New York City, obviously. I think of New Jersey. I don't think of Lubbock, Texas, when I think of a high transmission rate when it comes to the coronavirus here in this city. But obviously, if you've gone to the grocery store in the last few days, you've probably seen a lot of people wearing masks. You've probably seen people wearing masks in your at your favorite coffee shop drive-through as you go by. A lot of people are starting to wear masks, and well, there's a couple of reasons for this. One, they've been told that it could prevent somebody from getting coronavirus, which may or may not be true. So many of the studies, it actually seems to me, that have been done on this show that, yeah, the cloth coverings, taking a scarf or whatever, it might help, but it may not. Look at the CNET article that came out just the other day. According to the American Lung Association, 1 in 4 people infected with COVID-19 might show mild symptoms or none at all. Using a cloth face covering while you're around others can help block large particles that you might eject through a cough, sneeze, or unintentionally launch saliva, like through speaking. Close talkers. You don't want to get next to the close talkers. That's a bad idea. Close talkers during coronavirus, horrible. Absolutely horrible. Or sneeze unintentionally and launch saliva, the close talker, which could slow the spread of transmission to others if you don't know that you're sick. Quote, these type of masks are not intended to protect the wearer, but to protect against the unintended transmission. So, in other words, if you're wearing a mask, just one of these cloth masks that somebody makes, there's no guarantee at all that that's going to stop you from getting the coronavirus. In fact, the University of Minnesota has put out a piece that says data lacking to recommend broad mask use. We do not recommend requiring the general public who do not have symptoms of COVID-19 like illnesses to routinely wear cloth or surgical masks because there is no scientific evidence they are effective in reducing risk of SARS-CoV-2 transmission. That's basically COVID-19. Their use may result in those wearing the mask to relax other distancing efforts because they have a sense of protection, and we need to preserve the supply of surgical masks for the at-risk healthcare workers. Two things here on this. The N95 mask, the respirator mask, are probably absolutely fantastic at stopping you from getting the coronavirus. That's what they're made for. The surgical mask that you see, like true surgical mask, are a step down from the respirator mask. And then your cloth mask, or if you just take a t-shirt or a bandana or whatever, that's like so far down because there has not been a standard, if you will, and people still touch those masks. And we had Dr. John Thomas on the show this week of Operation Hope. He's been a surgeon in Lubbock for over 20 years, has done great work. And Dr. Thomas said about the mask that people who are not used to wearing masks, they end up touching the mask a lot, fidgeting with them. They're uncomfortable, so they move them around. And if you have touched different surfaces and you haven't washed your hands, you haven't cleaned off your hands with, some of the hand sanitizer that you have laying around, then you could be getting COVID-19 coronavirus on your mask, and you may not even know about it. Actually, same thing goes for even gloves. People who don't know how to take off gloves the right way for rubber gloves, they can actually infect themselves. So I would say this: if you're going to wear a mask in public or you're going to wear rubber gloves, look up some YouTube videos on how to actually handle a mask and how to actually handle gloves when you're taking them off, because a lot of people just kind of rip off the glove and they contaminate their hands without even thinking about it. We had Dr. Ronnie Jackson, who's running for Congress, former White House physician, on the show this past week, and he actually likes the idea of masks, but mainly because it'll stop people from touching their face. So there's two different ways of looking at it. You have some medical folks who say, no, you're going to touch your face all the time because you're not used to having the mask on. And then there's other folks who say maybe it'll remind you not to touch your face. It'll remind you not to touch your nose or your mouth or your eyes or anything like that. It's kind of like a blockade there to help you stop. The CDC now recommending that people do it in high transmission rate areas, especially in high transmission rate areas. I think it's up to every individual person. If you want to wear a mask, wear the mask, but make sure you're doing it in a responsible way to where you're not contaminating yourself. You're still practicing social distancing. Again, no close talkers. We don't want any close talkers during this time, okay? No close talkers during the coronavirus. And also, we need to wash our hands all the time. Wash your hands, get the hand sanitizer, got mine right here, get the hand sanitizer out and ready to go. The reason I bring this up is because you have so many cities that are looking at pushing even more measures onto the citizens. I don't know if it's going to happen here in Lubbock or not. You have some who are already floating the idea that everybody in Lubbock needs to wear a mask. I don't know if that's true. I don't know if everyone in the medical community actually agrees that everybody in Lubbock, Texas needs to wear a mask right now, especially if they're just, going out. If they go to the grocery store, practice social distancing. I think that, you hear some of these medical professionals who say it could lull you into this false sense that you don't have to be as careful. And I think that could be a detriment in some cases. But if you want to wear a mask, wear a mask. Should cities force us to wear masks? Absolutely not. Tune in to the Chad Hasty Show weekday mornings, 8:30 to 11 a.m. Central Time on News Talk, 95.1 FM and 790 a.m. KFYO. Oh, and by the way, this is why President Trump doesn't wear a mask. You see the news media, they're always harping on Trump to wear a mask. Trump doesn't have coronavirus. The people who are coming into contact with the president don't have coronavirus, and the press is far enough away from the guy where he's not that worried about catching coronavirus. That's where he's not wearing a mask. That's why you see a lot of people who don't wear masks if they don't think they're gonna catch anything, and they know they don't have coronavirus. So I don't know. It's a debate that's going to rage. I think that if anything, we need to continue to err on the side of personal responsibility and allowing the citizens to do what they want to do, at least, while we still have some of our rights left. Tune in to the Chad Hasty Show weekday mornings, 8:30 to 11 a.m. Central Time. News Talk 95.1 FM and 790 a.m. KFYO. We'll catch you next time.